Heart disease is the #1 killer in the U.S. and has been for several years, killing over 600,000 people every year, which translates to about 1 out of every 4 people. But what are the risk factors, and what can you do, even at an early stage in life, to prevent your risk of heart disease? Hi, I'm Tina Sanders, and today I'm going to explain what you can do to prevent your risk of heart disease, even from a young age. Heart disease can affect anyone, but tends to affect males more, with over half the deaths every year being men. Major risk factors for heart disease include having high blood pressure, having high cholesterol, and smoking tobacco products. Other factors include being diabetic, being obese, having a poor diet, having a sedentary lifestyle, or having poor physical activity, as well as excessive use of alcohol. Thankfully, several of these factors can be controlled by personal accountability of how much you drink, how much you smoke, what you eat, and how much of it you eat, as well as how often you can exercise. For factors such as diabetes, high blood pressure, and high cholesterol, which can be either caused by poor diet and exercise or can be genetic, there are medications and diet guides as to how you should live your lifestyle to prevent a buildup of any excessive blood pressure, cholesterol, or sugars in the body to cause less damage to your arteries, veins, capillaries, and heart. It is well known that it can take years to build up enough plaque to cause damage to your heart or blood vessels, and while this is true, that does not mean that the younger generation should not be worried about possible genetic factors that they cannot control, such as high blood pressure and high cholesterol, which need to be tested for at a younger age, so medication can help keep the cholesterol and pressure from building up and causing permanent damage, which will cause heart disease in later years or possibly even in their early 30s to mid-40s. The biggest thing to remember about heart disease is several of the risk factors are controlled if you use personal responsibility about your diet and exercise routines. Even if you have a busy lifestyle, make a schedule of how often you are available to exercise, even if it's simply doing a brisk walk for 20 minutes and eating properly. There are several guides on the internet that will help you fit your diet to your lifestyle. For those factors that can't be controlled, such as you have genetic caused high blood pressure or high cholesterol, talk to your doctor about medications that you can be on to prevent your risk of heart disease. Thanks for listening.